Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Vizient Pharmacy Vision Awards celebrate the values and achievements of our pharmacy members. The winners of the Excellence in Performance Improvement Award is given to an organization that achieves performance excellence and exceeds expectations in clinical, operations, specialty retail, or 340B pharmacy. With me today from the winning organization, Corewell Health, are Stephanie Field, VP of Finance and Pharmacy, and Margo Bowman, Senior Director of Clinical Pharmacy. I'm Gretchen Brummel, your program host. We are here recording live in Anaheim at the ASHP Mid-Year Clinical Meeting. Welcome to the podcast and congratulations on this award.
Thank you so much.
Well, tell me about your background and your organization.
Corewell Health is a newly formed organization made up of Legacy Spectrum Health in Grand Rapids, Beaumont Health out of the Detroit area, and then Lakeland Health out of St. Joe. But now we're all one organization, Corewell Health, and that's comprised of about 64,000 team members. We have a insurance wing that has 1.2 million lives covered. And it's just really exciting to be here with 21 hospitals, over 350 different ambulatory clinics and sites. It's continuing to grow and a really exciting time for us at Corewell.
Fantastic. Thank you. Did either of you want to talk about your backgrounds?
Sure. I have been at Corewell, Legacy Spectrum Health on the west side of the state. I've been in various pharmacy leadership positions in our digital services team, operations, and then ultimately pharmacy business. I've been with the organization for just under 15 years and have loved every minute of it.
Fantastic. Margo, how about you?
I've been at Corewell Health for 9.5 years. So I came in as a clinical pharmacy manager, did some stints in operations, back to clinical pharmacy, and now get to cover the system.
Well, thank you for those backgrounds and the information on the history behind Corewell Health. It's very helpful. I know a number of people were involved in the project behind your winning this award. Who do you want to recognize?
We had a newly formed team, the manager, Darren Jacks, who was our PGY2 resident, who came out of residency and tackled this program from the ground up, supported by his leadership team, Gabrielle, who is a pharmacy technician supervisor, Megan Miller, who is an Epic analyst on that team, and then Allie Peterson, who is our manager of ambulatory clinical pharmacy team.
Stephanie, tell me about the situation before the team started this work.
We were in a decentralized model for everything post-acute med coverage. So authorizations, med assistance, free med replacement. And those teams were comprised of non-clinical folks. They didn't have that background. We were really struggling with how do we support our patients in a way that is economical for them, made sense for the organization from a financial perspective, was more efficient than what we had been doing, and that wrapped our arms around the whole med use process. We were very good at inpatient, but as soon as those scripts were written, we just lost it to the ether. And we really wanted to know what was going on and making sure patients were getting supported. We have a very strong, robust MTM program with a lot of pharmacists in our community. This was that bridge that gapped the space between inpatient and ambulatory. So as we grew the team, we really saw this as a big opportunity of pharmacy to lean in. Folks that had pharmacy backgrounds could leverage that experience to really help patients.
Well, and I remember when we first thought of this idea and we were on a meeting and it just kind of clicked. We recognized the need and we said, we could do this ourselves and really bring it in under pharmacy. And I just remember that moment and thinking it was pretty cool.
Yeah, that's great.
And how did they approach coming up with the solution?
We took all of the key players and put them in a room together where we outlined a process map, current state, identified what those gaps were. We had people from different backgrounds all coming together to think about, how about this? What might work? What might not work? And what were those timelines that we needed to follow? What were some of our goals that we needed to hit and when? Because with this, it was a ton of change management. We were impacting other spaces. We wanted to make sure that providers were engaged and on board. It took a lot of change management for us. By pulling everybody together into one situation where we were able to walk through what that process might look like, it was really helpful for us.
The thing that we kept as a platform, a tenant, as we were going through the process mapping was, how do we leverage technology first? And we know we have pharmacy technicians and pharmacists that can navigate this in a way that's unique and super efficient, but how do we also give them tools that we haven't thought of before? We're an Epic house, and so how do we use clinical decision support and Epic's tools and maybe new and innovative ways, maybe ways that Epic has expected them to leverage this virtual team to support a really vast area of the state, and Epic was a big part of that.
So tell me about your project.
Our project was to stand up a multidisciplinary pharmacy team that sat in the middle of the medication care continuum to facilitate medication coverage. So we call it the Medication Care Coordination Team. It was a conglomeration of moving current resources from a central authorization team that was staffed by non-clinical team members, and then team members that were actually in the offices, like in an ambulatory office, to centralize that work, staff it with pharmacy technicians that were the front end intake, and they problem solve, how do we get coverage for these patients? What are the specifics to every situation that we're trying to solve? And then they have a support system wrapped around them of pharmacists, really for escalation, peer-to-peers. Is this dosing correct? We're running into this issue with this patient. How can the pharmacist help? Our pharmacists have collaborative practice agreements that allow them to be even more efficient within our organization. The project really was to have pharmacy touch as much of the medication use cycle as possible, but as efficient as possible way, right? We don't have endless resources, so how do we do this in a very smart way, utilizing our resources to make that happen?
Since implementation, what outcome improvements have you seen?
It's been threefold. We've had a lot of financial improvements for the organization on the delivery system side. We've seen significantly less write-offs and denials. We have a very significant impact. We have a health plan. The benefit they've seen on the administrative side and coverage, making sure we're sticking to step therapies and patients are started on the appropriate dose for that patient. The pharmacists are very integral in white gloving that through the process, which was not the case prior. The patient's experience has improved significantly. We went from some infusion areas seeing up to 12 days before they could get a patient scheduled for authorization, down to less than 2 days for non-oncology infusions and less than 4 days for oncolytics for chemos. The significance of how quickly those patients that are in a very stressed state, trying to figure out what this new treatment means for them, to get them in chairs, get those medications, and make it as seamless as possible. And efficiency. This was decentralized. Offices were doing this with MAs or nurses in some cases. And we were able to put this in a new virtual world, centralized, use technicians, cover far more areas with far less people and in a more efficient capacity. It's been beneficial all around, and we just continued that growth trajectory.
And then one thing that we keep hearing about at this meeting is around biosimilars and making sure that you're using the most cost-effective option. That has been one thing that we've been able to solve through this team. We have a good mix of clinical support to be able to make sure that what you're doing is appropriate and being able to find those cost-effective solutions for our patients.
The provider support can't be overlooked. Providers are being asked to see more patients and less time. Pharma, for all of its good things, is also very complicated and hard to navigate, and providers have been incredibly frustrated with that and their support staff. So to move that to pharmacy, to be able to translate for them in what this means for their patient in a way that's simple for them and straightforward, has made it very symbiotic. Like, the providers are ecstatic, their patients are happier, the support staff feels less stressed, and it's really like a mini center for excellence. And they know that they can count on them to problem solve. And sometimes there's not a solution that the provider finds to be the best solution for the patient. And then there's steps we can take to say, well, here's what we can get them on, or here's what we can do with the payer coverage, or here's the free med we can try, or a grant we can try. And that removal of stress from those providers has been one of their biggest piece of feedback.
So you've really seen multiple impacts across the healthcare continuum. I was wondering if you could expand a little bit more on the patient impact. I know you touched on it, but dive a little deeper into that.
One of the coolest stories, and we get quite a few testimonies sent into us just about patients' experiences. One that we had recently was extremely heartfelt. The patient was undergoing significant infertility issues. And through this process, she was trying to figure out what was the right therapy. How am I going to get it? How am I going to afford it? All of those things, a lot of no's in her life at that time. And it was special because she was able to use the medication care coordination team, get the medications that she needed, and is pregnant right now. We're just really excited to be able to help support those patient outcomes when we know how important this type of treatment is. It's neat. Not only are they seeing quicker access, more medications that they need, getting approved, it makes it special when you can hear stories like that.
Yeah, it's definitely a great story. Thank you for sharing that with us. How have your frontline staff responded to the program?
Our frontline staff in the pharmacy have seen it as a growth opportunity for them. So it's remote, it's patient-facing, it's a lot of solution orientation, figuring out how to help the patient, especially for our technician team. We want to retain our techs, so our highest functioning technicians have found this as a growth opportunity from a career perspective. Our frontline team members in our infusion clinics and in our offices, our ambulatory offices, see this as one of their buoys doing patient care. Darren, our manager in that space, is one of the most empathetic empathetic, best leaders that have come out of our residency program. And he has been incredible. And the teams in those spaces feel like they're supported in a way that they never expected. Talk about testimonials. We get that from the offices all the time. As all projects go, we had a timeline on how we were going to roll this out. And as things were, our diabetes team was like, hey, we're really struggling, especially with GLP-1s. We're just inundated. What can you do to help us? And so we pivoted. We went in that space. They were about 900 auths behind at one point. We were able to buckle down, get them cleaned up. And there were practice managers in tears. We were so overwhelmed. This change in therapies came. Patients are calling like crazy. We don't know what to tell them. You guys just walk us right through it and tell us exactly what we need to tell them in a way that is effective, it's clear, it's kind to the patient. And with GLP-1s, you're not always going to get the answer you want. That has been one of the best frontline staff pieces of feedback, how much better they're communicating with their patients because the team supports them, the education, the information, the navigation.
Well, and everybody wants this support. And I have so many pharmacists in different clinics that are asking, when is medication care coordination or MCC coming to us? Really being able to scale it up and scale it up quickly has been vital, but everybody wants this type of support because it really puts it in the hands of people that make the most sense to do this work.
How are you looking to enhance the program in the future?
The enhancements come twofold. It's expansion in a methodical way where you're going to have the most impact. So specialties, areas that are writing a lot of specialty medication scripts, doing a lot of infusions. How do you roll that out in a way that also is mindful of resources? All of us are talking about finances this week. That's always a conversation in pharmacy. And we don't have endless resources. There's tech shortages, et cetera. So how do we leverage technology? Epic has infinite possibilities. We have a very smart pharmacist engineer on the Epic side and some analysts that have this agile process, and we call it a dedicated team, that work through all of the enhancements we can make to the process to make it more efficient, less burdensome on the patient, less burdensome on our team. Right now, they're really investigating how AI can help pull some of that information out of the record, automate some of the authorization work. And so then they are just doing a cursory review and submitting it to a payer rather than doing a lot of data digging into a chart. How can we use technology to be even more efficient? And that's really the next horizon for enhancement.
Thank you both so much for joining us today to share your perspectives and expertise. I'm so glad that you could be here with us.
Yeah, thanks for having us.
And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.